A few months ago, researchers at a major medical center fed millions of patient records into an AI system. Medical histories, lab results, vital signs, genetic data, lifestyle factors. Everything the hospital knew about every patient who had passed through its doors over a decade. Then they asked the AI a question that sounds like science fiction. Given everything you know about this living patient right now, when will they most likely die? The AI answered. Patient by patient, month by month. And when researchers checked the predictions against what actually happened to those patients over the following years, the results were shocking. The AI was right over 80% of the time, predicting death within a 3-month window, sometimes years in advance. This is not a hypothetical. This is not a research paper about the distant future. This is technology that exists right now, in hospitals you could walk into today. And it raises questions that our society is completely unprepared to answer. Who should have access to that prediction? The patient? The family? The insurance company? What do you do differently if you know with 80% confidence that you have 18 months left? What if the prediction is wrong? What if it is right? I have spent weeks researching AI mortality prediction, talking to doctors who use these systems, ethicists who study their implications, patients who received predictions they never asked for, and the companies racing to commercialize the most intimate data about your life. Its likely end. Let me start with how this technology actually works, because the science behind it is as fascinating as the ethics are troubling. Traditional medicine is surprisingly bad at predicting death. Doctors routinely overestimate how long terminally ill patients will live by a factor of 3 to 5. This is not because doctors are incompetent. It is because human intuition cannot process thousands of interacting variables simultaneously. A patient has slightly elevated liver enzymes, a particular genetic marker, a certain combination of medications, a social history that suggests limited support at home. Each factor contributes a tiny amount of risk. No human can integrate all of these signals into a precise probability, but AI can. Modern mortality prediction models process hundreds or thousands of variables per patient and identify patterns that no human physician has ever noticed. The most widely used system in American hospitals is called the Epic Deterioration Index. It runs silently in the background of the electronic health record system used by over 250 million patients in the United States. Every 15 minutes, it recalculates each hospitalizing probability of declining or dying within the next 6 hours. When the score crosses a threshold, it alerts the care team. A rapid response team may be dispatched. The patient level of monitoring may be escalated. These interventions demonstrably save lives. Studies published in major medical journals have shown significant reductions in unexpected deaths at hospitals using these systems. But the system also makes mistakes, and those mistakes have consequences that go far beyond statistics. I spoke with a physician at a major teaching hospital who described a case that haunted her. A young mother, admitted for a routine procedure, was flagged as high risk by the AI system. The alert triggered a cascade of interventions, none of which she actually needed. The AI had misinterpreted a combination of lab values that were unusual for her age but completely normal for her specific condition. The unnecessary interventions led to complications, extended her hospital stay by a week, and generated over $100,000 in additional medical bills. This is the fundamental challenge of AI mortality prediction. The system does not need to be perfect to be useful. At a population level, an 80% accurate prediction system will save far more lives than it harms. But at the individual level, every false positive is a person who received unnecessary treatment, unnecessary anxiety, unnecessary cost. And we have not even addressed the most unsettling question. What happens when the prediction is not a 6-hour alert, but a 6-month or 6-year forecast? What happens when an AI tells you, with quantifiable confidence, that your odds of surviving the next 5 years are 20%? This technology exists now. Researchers at the University of Nottingham developed an AI system that predicted premature death with significantly higher accuracy than standard methods used by human physicians. Their model analyzed lifestyle factors, biometric data, and medical history to generate 5-year mortality predictions. A team from Google and several academic medical centers published a paper demonstrating an AI system that could predict in-hospital mortality, 30-day readmission, and length of stay using nothing but the raw data in electronic health records. No special tests, no additional data collection. Just the data that already exists for every patient. Stanford researchers built a model that predicts end-of-life care needs with enough accuracy to help palliative care teams allocate their limited resources to the patients who need them most. The model identified patients who would benefit from palliative care consultation, but whose physicians had not yet made the referral. These are not academic exercises. These systems are being deployed, and the accuracy is improving rapidly as models are trained on larger datasets and incorporate more types of data. Wearable device data, genetic information, social determinants of health. The more data goes in, the more accurate the predictions become, which brings us to the elephant in the room. Insurance companies are watching this technology with intense interest. And if you think your health insurance company would not use an AI mortality prediction to make decisions about your coverage, I have some bad news for you. Life insurance companies have been using predictive models for over a century. The entire industry is built on actuarial science, predicting how long people will live and pricing policies accordingly. AI makes those predictions dramatically more accurate and dramatically more personal. Health insurance companies are moving in the same direction. The Affordable Care Act prohibits denying coverage based on pre-existing conditions, but it does not prohibit pricing based on predicted future costs. If an AI can predict with high confidence that a specific patient will develop an expensive chronic condition, the economic incentive to price that patient out of the risk pool is enormous. Several health insurance startups are already using AI-driven underwriting to price individual policies. They market themselves as using technology to offer fairer pricing. But the fairness of the pricing depends entirely on whether you are the person the AI predicts will be healthy or the person it predicts will be sick. But I do not want to present this as purely dystopian. AI mortality prediction also has genuinely life-saving applications that deserve celebration. Early warning systems that detect sepsis hours before human clinicians notice the signs, predictive models that identify patients at risk of suicide and trigger preventive interventions, SIPTs. AI systems that optimize organ transplant waiting lists by more accurately predicting which patients will survive long enough to benefit from a transplant and which are likely to die waiting. These are not hypothetical applications. They are saving lives right now. The paradox of AI mortality prediction is that the same technology that could be used to deny you insurance could also save your life. The same algorithm that predicts your death can also tell you how to prevent it. Knowing you are at high risk is terrifying, but it also gives you the information you need to change the outcome. Which brings us to the billionaire longevity race. While hospitals are using AI to predict death, a parallel effort is using AI to postpone it, possibly indefinitely. Companies like Altos Labs, funded with $3 billion from Jeff Bezos and other billionaires, are using AI to understand the biology of aging at the molecular level. Calico, Google anti-aging company, has been using machine learning to analyze aging biomarkers for over a decade. Their approach is to treat aging itself as a disease that can be understood, measured, and ultimately treated. AI is central to that effort. The emerging field of aging clocks uses AI to measure biological age, how old your body actually is, as opposed to your chronological age. These clocks analyze patterns in DNA methylation, blood proteins, and other biomarkers to estimate how much aging damage has accumulated in your body. The most accurate clocks can predict mortality risk better than any other single measure, including cholesterol levels, blood pressure, or even a physician overall assessment. And they are improving rapidly as more data becomes available. Here is the question I keep coming back to. If an AI can tell you with 80% confidence that you have 2 years left, would you want to know? Some people say absolutely yes. Knowing would let them prioritize what matters, repair relationships, complete important projects, say the things that need to be said. Other people say absolutely not. Knowing would destroy their ability to live normally. Every moment would be shadowed by the countdown timer. The prediction might become a self-fulfilling prophecy as the stress of knowing accelerated the decline that was predicted. The ethical guidelines around AI mortality prediction are almost non-existent. There are no federal regulations in the United States governing how these predictions can be used. HIPAA protects your medical data from unauthorized disclosure, but it does not address whether a prediction about your death is information that you have a right to know or a right to refuse. Should doctors be required to tell patients what the AI predicts? If the AI says a patient has a 70% chance of dying within 6 months, but the doctor disagrees with the prediction, whose judgment prevails? If the AI is right and the doctor is wrong, is the doctor liable for failing to act on the AI warning? If the AI is wrong and the doctor followed its recommendation, is the doctor liable for trusting the machine? These are not hypothetical legal questions. They are questions that hospital ethics committees are wrestling with right now, and the answers will shape how AI is used in medicine for decades to come. The technology of AI mortality prediction is not going away. It is going to become more accurate, more personalized, and more deeply integrated into healthcare. The only question is whether we will develop the ethical frameworks, the regulations, and the social norms to use it wisely before it is deployed at scale. Because right now, we are deploying first and asking questions later. And when the question is about how long you have left to live, later might be too late. If you found this exploration valuable, hit subscribe and turn on notifications. We tackle the hardest questions in AI every single week. Next week, I am doing something I have never done before. I sat down with 5 of the most powerful AI CEOs in the world and asked them the question they are most afraid of. Their answers will surprise you. In the comments, I want to know. If an AI could predict your death with high accuracy, would you want to know the date? Why or why not? I read every response. Thanks for watching. Stay curious, and I will see you in the next one.